Welcome to Research Roundup by Integrated Benefits Institute, the podcast where we dive into the latest trends and research in the workplace health and productivity space. I'm your host, Dr. Sarah Lee Gurlau. Each episode, we will bring you the most recent studies, insightful analyses, and actionable takeaways to help you create a healthier, more productive workplace. Whether you're an employer, a benefits consultant, or a vendor, this podcast is designed to keep you informed and ahead of the curve. Let's get started. Our first study, published in the Journal of Exploratory Science of Medicine, looks at semaglutide and tirzepatide use and reduction of cardiovascular risks in adults with overweight and obesity. This U.S. study evaluated the impact of anti-obesity medications like Wegovy and Zepbound on cardiovascular disease risk in adults with overweight and obesity. Analyzing data from over 100,000 individuals, the results showed a striking 63% lower cardiovascular risk with anti-obesity medication use. Interestingly, tirzepatide, known as Zepbound, users had an even lower cardiovascular disease risk than semaglutide users. These findings suggest that medications show promise not only in managing obesity, but also in potentially reducing healthcare costs and increasing workplace productivity. Employers might consider including these medications in their health plans to promote health equity and educate employees about managing their weight effectively. Next, we have a study from Preventive Medicine entitled The Association Between Precarious Employment and Stress Among Working-Aged Individuals in the United States. This research examines how unstable employment conditions affect stress levels among U.S. workers. The study measured precarious employment based on factors like low wages, inconsistent work hours, job instability, and lack of benefits. The results are concerning. Higher levels of precarious employment were associated with increased perceived stress and higher levels of C-reactive protein, a biological stress marker. These findings highlight the potential health risks associated with unstable employment conditions. Organizations may want to reassess their employment practices considering how improved job stability, better wages, and comprehensive benefits could contribute to a healthier, less stressed workforce. Our third study, published in Economic and Industrial Democracy Journal, asks the question, Job Insecurity and Health and Well-Being. What happens when you really need or love your job? This research explored the relationship between job insecurity and employee health and well-being, with a focus on economic dependence and job satisfaction. Using data from 679 U.S. workers, the researchers found that job insecurity led to lower life satisfaction and poorer self-related health. Interestingly, these effects were worse for workers who relied heavily on their job financially and had high job satisfaction. The findings underscore the complex interplay between financial and psychological factors in job insecurity. A key takeaway for organizations is to pay particular attention to workers who are financially vulnerable or highly invested in their jobs when implementing strategies to mitigate the negative effects of job insecurity. Next, we turn to a study from the Employee Relations International Journal entitled Is the Future of Work Hybrid? Examining motivations and expectations related to working from home in knowledge workers' lived experiences. This research explores how motivations for working from home evolved for knowledge workers following COVID-19 pandemic. The study found that while workers initially faced challenges adjusting to remote work over time, their motivation became more intrinsic, leading to a strong preference for hybrid work arrangements. Factors like career advancement, concerns, and lack of voice were identified as demotivators. Yet the overall desire for working from home remained strong post-pandemic. These insights into the increased demand for hybrid work schedules can help organizations better address employee expectations. Employers might consider implementing flexible work policies that balance the benefit of remote work with opportunities for in-person collaboration and career development. Our fifth study comes from the Leadership and Organization Development Journal. It's called CEO Reflections on Leadership Lessons from the Global Pandemic, Back to Basis During Crisis. Researchers interviewed 30 CEOs across diverse U.S. industries to examine how they adapted their leadership strategies during the COVID-19 pandemic. The study highlights that returning to fundamental leadership principles, such as clear communication, rapid decision-making, and empowering teams, was essential in managing the crisis. The CEOs stressed that the importance of fostering strong relationships, both internally and externally, to improve problem-solving and ensure transparency. These findings suggest that even in non-crisis times, focusing on these basic leadership principles can enhance organizational resilience and effectiveness. Companies might benefit from leadership development programs that emphasize these fundamental skills. Our final study for today, published in the Journal of Healthcare Organization, Provision, and Financing, is titled Impact of Site-Neutral Payments for Commercial and Employer-Sponsored Plans. This research explores the potential financial effects of applying Medicare's site-neutral payment to commercial health plans. The study estimates a staggering $58 billion in savings in 2022 alone, with projected 10-year savings of $898 billion. For employers, this could translate to significant premium reductions estimated at 5.4% in 2024 and 5% by 2033. These findings highlight potential substantial cost savings for employers providing health insurance. Organizations might want to stay informed about policy discussions in this area and consider advocating for such changes, as they could significantly impact healthcare costs and benefit planning. That wraps up this episode of Research Roundup by Integrated Benefits Institute. We hope you found the insights valuable and the research thought-provoking. If you enjoyed today's episode, please subscribe to our podcast and leave us a review. Your feedback helps us to improve and bring you the content you need. Don't forget to share this podcast with your colleagues and network. Join us next time as we continue to explore the latest trends and research in employee health and well-being and workplace productivity. Until then, stay curious and keep learning.